Good morning and welcome. Today is Thursday, August 24th. I am Allison Johnston, a Professional Development Coordinator for Maryland's Developmental Disabilities Administration. We welcome you to today's presentation, Person and Family Training on the Policy on Reportable Incidents and Investigations. Before we begin, I would like to remind you of a few things about today's webinar. All participants are in listen-only mode. The session is being recorded and will be available for future use. There is one handout for today's presentation, and it can be found in the handout section on the panel box. Questions can be typed in the question or chat box within the webinar panel, and we will get to those as time permits. Our presenters today are Nicole Kropfelder, Statewide QE Director, Dawn Harrison, Western's QE Director, Mark Celeste, Southern's QE Director, Caroline Bailey, Eastern QE Director, Shireen Hodryan, Central QE Director. Now it is my pleasure to turn this presentation over to Nicole.
Thank you, Allison, and good morning, everyone. Thank you for joining us today for our Policy on Reportable Incidents and Investigations, known as PORII training. Our number one priority for people we support is their health and safety, and that is why it is important we created the statewide PORII training based on our current policy, in which we provided last month to providers, coordination of community services, known as CCSs, support brokers, financial management counseling services, FMCSs, DDA staff, and any others who wish to attend. Today is your opportunity to receive the same information in plain language and allow you to understand the whole process with incident reports in our state. We truly do hope you find this information useful, and please know any of us on the webinar today is available for any assistance. Given the length of today's presentation, the importance of this topic, and the need to be as specific as possible, we do ask that all of you put your questions in the chat box, and we will respond within 2 weeks of today's webinar. Next slide, please. Today, we will be reviewing some of the ins and outs of PORII. There will be a lot of information that will be covered, but by the end of this training, each of you will be able to understand the purpose of PORII, who it pertains to, the types of incidents, reporting process and expectations, and some incident reporting reminders. We have also included the direct link to PORII, so you can pull it up and have direct access to the policy. So please make sure you save this to your computer and have as an available resource. We have a lot of information to go over with great resources that I hope each of you utilizes and uses the context in this presentation to reach out for any additional questions after today. Next slide. Okay, to get started, let's understand what PORII is. PORII is the Policy on Reportable Incidents and Investigations. PORII outlines the following requirements of how to report, when to report, the different types of incidents to report, the responsibilities of reporters, and the requirements of submitted documentation. Next slide. PORII was developed to protect the rights and to ensure the health, safety, and welfare of people with developmental disabilities receiving services from DDA licensed and DDA funded providers. PORII applies to any incident that threatens the health and safety and/or has the potential to cause harm to a person. Next slide. What are reportable incidents? They are significant events or situations that, because of the severity or the sensitivity of the situation, needs to be reported. Mandated reporters are required to notify the Regional Office Quality Enhancement QE team immediately by using the Regional Office QE triage email or phone. Those mandated reporters who have access to PCIS2, which is DDA's software program for incident reporting, is required within 24 hours of the data discovery to submit an incident report. Here are some examples of reportable events: abuse, neglect, medication errors, choking, emergency room visits, and many others. We will go more in depth about each of these later in the training. Next slide. So who does PORII apply to? On this slide, you can see the various individuals that PORII applies to, from people, DDA staff, to providers, to quality improvement organizations, support brokers, and many others. Please also remember many that are on this slide are considered to be mandated reporters. Next slide. Some general requirements of PORII are incident reporting. This explains the most common types of incidents that should be reported, in which we will capture later in the training. At times, there may be some incidents that are not necessarily described or outlined in PORII and classified as other, but each provider, support broker, or FMCS must have an internal protocol to determine if other incidents should be reported and investigated. Agency internal protocol. Each reporting entity, whether it's providers or CCSs, FMCSs, shall have developed their own internal protocols to make sure they are following PORII requirements. Next slide. So let's discuss agency internal protocol now. This means operating procedures should be developed that outline the responsibilities and roles of all staff of the following: how to identify an incident, how and when to report and investigate, reviewing and addressing incidents, monitoring the follow-up of incidents, and identify the needed trainings to ensure all of the above are completed. Each agency is to have appointed and qualified staff to report and investigate incidents. These staff members need to complete an investigations training. They are to follow all the requirements and processes within PORII. Next slide. Policy communication. Each agency is responsible for posting PORII along with specific internal protocols at all licensed sites and electronically to all people, staff, consultants, volunteers, and others. Along with specific internal protocols being posted, providers, CCSs, and others are to list all of their emergency contacts internally and also provide the DDA regional office contact information. All of this information should be made available both electronically and posted in the home. Next slide. Requirements. Freedom from retaliation. We always want everyone to feel as if they can report anything without having the fear of them getting in trouble. It is the expectation that all mandated reporters have measures in place to help reduce the potential for retaliation when one makes a report. Comprehensive approach. As we all understand, making sure people's safety and well-being is our main priority, we want to make sure a full approach is developed in reviewing and conducting investigations. The Office of Healthcare and Quality, also known as OHCQ, triages and reviews each incident, ranks each of them, and investigates all of the type 1 incidents. And we will break down the ranking categories and different types of type 1 incidents that are reviewed by OHCQ later in this training. As OHCQ is reviewing all type 1 incidents, the DDA regional offices are triaging all incidents and investigates all type 2 incidents. Again, we will review type 2 incidents later in the training also. Please remember, at times there may be a type 2 incident that comes in, but the regional office feels it may need to be sent to OHCQ for a further review. Please also note, when we discuss this policy further and we note working days and/or business days, that refers to Monday through Friday, excluding state holidays. This does not mean that mandated reporters only report on those particular working or business days. This just explains that this is when OHCQ and the DDA regional office are working and reviewing each incident. Next slide. I'm sure many of you are wondering how incidents are reported to DDA. DDA has a software program specific to incident reporting. This is called Provider Consumer Information System, known as PCIS-2. When an incident report is submitted in PCIS-2, automatic notifications are made to the following people: the provider, the person CCS, OHCQ, and the DDA regional office. When submitting an incident, the reporter should be notifying legal guardians, as this is noted within the incident report, as this is best practice. Next slide. Here we will go over the reporter's responsibilities. Number one priority and responsibility of anyone reporting an incident is to confirm the person's health, safety, and/or well-being of any person involved is safe. This becomes especially important during allegations of abuse or neglect. It is not enough for management to be notified of a situation that occurred on Saturday evening on Monday morning, as this has now allowed the Q staff to continue to work with the person over the weekend. The agency can then be cited for failure to protect the person. It is the responsibility of both the agency and the CCS to notify families and/or advocates, CCSs and other agencies such as Adult Protective Services, Child Protective Services, and/or even the police. When making an incident report, providers are to report to DDA within 1 working day of the incident or data discovery in PCIS 2. Please remember, if it's not documented, it didn't happen. Currently, support brokers do not have access to PCIS 2, so we ask them to report an incident to the person's CCS. Please also remember the data discovery is the date the agency director or designee was advised of an incident. Each agency shall investigate each incident per their internal protocols. They must submit an agency investigative report, known as an AIR, within 10 working days of discovery, and then submit to a standing committee for review of each incident reported. An AIR is the documented follow-up the reporter completed about the incident. So at times the CCS may call you to receive an update on how you're feeling or your loved one is feeling after a fall. Each provider shall continue to follow up and take any necessary actions to resolve whether if the incident is a systematic change or it is case by case. Next slide. Support broker and financial management counseling services responsibilities. As stated previously, the number one priority and responsibility of anyone reporting an incident is to ensure the health, safety, and/or well-being of any person involved. This becomes especially important during allegations of abuse or neglect. It is the responsibility of the support broker and the FMCS to notify families and/or advocates, CCSs, and external entities such as APS, Adult Protective Services, or Child Protective Services, and/or police. Support brokers and FMCSs currently cannot send an incident report in PCIS 2. Therefore, they must report an incident to the person's CCS. DDA encourages support brokers and FMCS, when you contact CCS via phone, also follow up in an email to make a report. Please remember, if it's not documented, it didn't happen. Reporting to the CCS should still be reported within 1 working day of the incident or data discovery. So keep in mind when you or your loved one has an incident to call your CCS as soon as possible to let them know. Now I'm going to turn this over to Dawn Harrison, who is the Western Regional Quality Enhancement Director.
Thank you, Nicole. Here, please note the areas of OHCQ incident priority and guidelines for investigation. All of this, again, is noted in great detail in PORII. Immediate jeopardy. This is when an incident presents immediate and serious threat of injury, harm, impairment, or death of an individual. OHCQ will begin an investigation within 2 working days. High, when an individual is not in imminent danger, but the incident presents a situation where serious threat exists to the individual's health or safety that could compromise the individual's physical and/or mental health. Here, OHCQ will begin their investigation within 10 working days. Medium, when an incident involves a situation or there is an opportunity for harm that would minimally affect the individual. OHCQ will begin an investigation within 30 working days. Administrative review, an incident presents minimal risk of harm and/or no harm at all, and an on-site investigation is not needed. At times, the reporting entity, whether that be CCS or providers, may have already submitted documentation addressing the fact that the incident has been addressed with implementation of corrective and preventative measures. At this point, OHCQ will communicate electronically with the reporting entity. Referrals. OHCQ will make a referral within 1 working day if necessary. Referrals occur when there's an opportunity for criminal issues and require legal assistance, or if the incident is outside of the OHCQ jurisdiction. And then there are times no further action is taken, and this is due to the incident being resolved appropriately at the time of reporting. This means the participants' health and safety are assured and the reporter has implemented corrective actions. The DDA will review the AIR and report to OHCQ if further action is needed. Next slide, please. Here we note the type 1 incidents that are all reportable via PCIS2 within 1 working day, and the DDA regional office is alerted and OHCQ completes their investigation process upon notification. Type 1 incidents include abuse, neglect, death, injuries, hospital admissions, choking, and medication errors. The first step when an incident occurs prior to reporting is always to ensure the health and safety of the individuals. This could mean you remove them from the environment, put safety measures in place immediately, or provide first aid until further evaluation. But safety is all of our #1 priority. Next slide, please. As discussed earlier, each agency is responsible for developing their own internal protocol related to PORII. Within this protocol, it outlines the responsibility in regards to internal investigated incidents, also known as the A5. Agencies are responsible for investigating events or situations. Examples include type 1 or type 2 incidents within 1 working day of discovery. Each agency ensures the health and safety of the participant and follows their internal protocols related to investigations. This should include within 21 days, the agency submits the agency investigative report, also known as the AIR, to their standing committee for review. All internally investigative incidents are submitted to the DDA on a quarterly basis for a full review. Next slide, please. First, we will discuss abuse. The definition noted in PORII states, abuse is the willful infliction of injury, unreasonable confinement, intimidation, or punishment with resulting in physical harm, pain, or mental anguish. This includes, but is not limited to, physical abuse, such as hitting or choking, verbal or mental abuse, such as yelling or name-calling, or belittling behaviors, and sexual abuse and seclusion. Abuse can occur between staff and individuals, also within 2 or more individuals. Next slide, please. Abuse needs to be reported when there is a suspected or confirmed incident of physical, sexual, or psychological abuse, inhumane treatment, or a violation of the individual's rights that involves staff and an individual or individuals involving 2 or more. Next slide, please. Abuse may be treated as an internally investigated incident when an individual has a history of making false allegations, which should be documented within their person-centered plan and behavior plan. When there is an incident involving physical contact or alleged physical contact between 2 or more individuals, that does not result in injury, or if the injury is sustained, can be treated as an internal investigated incident. Please remember to notify Adult Protective Services or Child Protective Services, if applicable, and follow internal protocols. And remember, we are all mandated reporters. Next slide, please. After an abuse or any other incident occurs, many actions take place. I cannot emphasize enough that ensuring the individual's safety is number one. Here are several additional questions that are encouraged to ask reporters as they are navigating through any type of incident. Was the aggressor removed from the individual? At times, our initial reaction is to remove the victim or your family member. And in some situations, they then may see themselves as the one at fault. It is usually best to remove the aggressor from the environment immediately. Then we begin to process next step. Was medical attention warranted? The best practice is to have the victim examined by a medical professional. Report the incident to the applicable parties, such as Adult Protective Services, Child Protective Services, or law enforcement. Allow for a full investigation. And remember to always think about the victim and what ongoing supports they may need to be successful. Even if you suspect abuse, you must report it. And now I'm going to turn it over to Mark Celeste, the Quality Enhancement Director for the Southern Region. Mark?
Thank you, Dawn. Neglect is another type 1 reportable incident. The definition in PORII states the failure to provide proper care and attention to an individual that results in significant harm or jeopardy of harm to the individual's health, safety, or well-being, and failure to provide life necessities, such as food, clothing, shelter, medical treatment, supervision, or a safe environment. Next slide, please. When do you report neglect? When there is any suspected or confirmed incident of neglect or mistreatment of an at-risk, vulnerable person. Next slide. Hospital admissions and emergency room visits. A hospital admission is the unexpected or unplanned admission or an inpatient service that is not documented within a person's person-centered plan, as a need for one to visit the hospital, often due to continued physical health or psychiatric conditions. An example of a hospitalization due to a person receiving medical care, often because of a continued medical condition, would be when a person has a chronic urinary tract infection and is hospitalized because of the UTI or infection. The agency to internally investigate, but not have to report immediately to the DDA. But if the person had a major surgery, like a bladder or a kidney removed, that would require an incident report immediately. A reportable emergency room visit would be when there is a moderate or severe injury, such as a fractured arm, in which it should be reported as an injury. Next slide, please. So when do we consider a hospital admission, an ER visit, an internally investigated incident? When a person frequents the hospital and it is documented within their person-centered plan, a provider can submit this as an internally investigated incident. A person seeks the emergency room for a visit and is not admitted, but are in observation and or treated and released. They are also considered internally investigated. At times, many of us will go to an urgent care to be seen instead of the emergency room. These incidents should be internally investigated also, unless there was a moderate or severe injury. Next slide, please. Injuries. The definition of an injury is any physical harm, hurt, or damage to an individual caused by an act of that person or others. Keep in mind any injuries that result in medical emergencies that require immediate assessment and intervention are reportable incidents. Next slide. Medication errors. A medication error is the failure to administer medications as prescribed or given medication that is not prescribed by a licensed doctor. This would include an incorrect dose, the wrong time, the wrong route of administering medications. Next slide, please. When are medication errors reportable to the DDA and the Office of Healthcare Quality? Report the med error when it has the potential to cause harm or results in needing medication or dental observation by a doctor, nurse practitioner, or dentist, or causes an admission of a hospital stay or a 24-hour infirmary for treatment and/or observation. Medication errors are internally investigated when an error does not have any adverse effects that require medical attention. But remember, medication errors are immediately reported to the agency designee per internal protocols. Next slide. Choking. Choking occurs when there is something stopping the flow of air from the environment into the lungs, whether it is partial or complete. When is choking considered to be a reportable incident? May lose consciousness or receive CPR as a result of the choking, or when choking occurs as a result of failure to train staff on a person's specialized diet and or follow protocol for a choking victim. When the Heimlich maneuver or foreign body airway obstruction intervention is used and works, this would be considered an internally investigated incident. Please also keep in mind, people who have a history of choking should have this written in their nursing care plans and their supervision levels during meal times noted. Unfortunately, some people have passed away from choking from lack of staff supervision. Staff walk away and prepare another person's meal. They may provide activities of daily living for others due to laundry, or at times thinks it's okay to take their own break. It's very important to know the person and what supports are in place and/or proper training that is needed. When a person passes away, whether it was suddenly or expected, regardless of the reason, it's reported immediately. Now I'm going to turn it over to Caroline Bailey. Caroline is the Eastern Shore Regional Quality Enhancement Director.
Thank you, Mark. Next slide, please. Now we will discuss Type 2 incidents per PORII. Type 2 incidents are reviewed and investigated by the DDA Regional Office QE team. We will discuss each Type 2 incident more in depth, but they include contact with law enforcement, fire department, and EMS, theft of a person's property or funds, unexpected or risky absence, restraints, and other. Next slide, please. Law enforcement is one of the reportable incidents that the regional offices within DDA reviews. Here we will go over reportable versus internally investigated when it comes to law enforcement. Law enforcement is reportable when they're responding to a person's behavior and this person does not have a behavior support plan in place, or the behavior support plan was not started, or they are a safety risk to themselves or others, and that's all considered to be reportable incidents. At times, we have seen law enforcement reporting due to a person's behaviors, and then they are taken to the hospital to be seen for a psychiatric admission. This would then be considered a Type 1 incident hospital admission or an ER visit if not admitted. When a person is arrested and taken into custody, this is considered a forensic case within the DDA. Many times, law enforcement will respond to a call related to theft, but that should be reported as theft and not law enforcement. We will discuss theft later on. Next slide, please. Internally investigated incidents occur when police come, but a written police report is not taken, or when they respond to a person's behavior, but they are not considered to be a safety risk to themselves or others. One key item to remember to get from the police is the police report number, badge number of the officer, and all of their contact information. This will help aid additional information if it is needed when reviewing the incident report. Next slide, please. Fire department and emergency medical services, or EMS, is very straightforward when it comes to reporting. Any incident that requires the fire department or EMS is considered reportable. Please remember to gather contact name and number of the emergency personnel to include in the reporting. Next slide, please. Theft is when any suspected or confirmed stealing of a person's personal property or money occurs. When it is determined to be valued at $50 or more per incident, or 100 or more stolen over the course of 30 days, it is considered to be reportable. Anything less than $50 would be internally investigated. Next slide, please. Unfortunately, there are times that unexpected or risky absences of a person does occur. It is important that when the person is missing for more than 4 hours or is an immediate danger to themselves or others, that all parties are made aware immediately. This includes police, families, CCS, the DDA, and the list can go on, but each agency should have their own internal protocol to follow all PORII requirements. There are times that missing person reports are noted on social media, and the DDA is the last to be informed. The DDA needs to be made aware immediately. A quick email to the regional office noting the incident, and then IR would follow per guidelines would be most helpful. Next slide, please. Restraints include any physical, chemical, or mechanical intervention that is used to stop a person's physical mobility. Next slide. It is important to remember to report any restraint that involves a person who does not have it noted within their approved behavior support plan, a restraint that is not part of the DDA approved curriculum MAT training, if it restricts the movement of a person as a substitute for programming or disciplinary purposes, and lastly, if the restraint results in an injury. Next slide, please. Chemical restraints are those medications that are used to restrict a person from moving. At times, some people will require a chemical support to sedate them for medical procedures such as teeth cleaning. This would not need to be reported as it is a preventative measure and not a response to a behavior. Chemical restraints that are used as a response to a challenging behavior are to be reported. When a restraint does occur, please keep in mind per COMAR, which are the DDA regulations, a team meeting will need to be held within 5 calendar days to review the situation and action taken. Other areas to think about when reporting an incident are: does the person have a behavior support plan? If so, is the behavior targeted in the behavior support plan? Or does a behavior support plan need to be created? What medication and how is the medication given? And in what setting was the chemical restraint occurring in? Lastly, did the restraint occur as a result of the health and safety of the person or others? Next slide, please. At times, some incidents happen that are not labeled or outlined in PORII, in which we would call them other, when they affect the health and safety of a person. A few examples of this may be suicide threat or an attempt, a communicable disease outbreak per the Centers for Disease Control or local health department. Other incidents can include vehicle accidents with the potential for injury, and all incidents that may be on the news or social media. Many times, the DDA staff will see social media posts of missing persons that were not reported, so please remember these incidents are highly important and need to be reported immediately. Now I'm going to turn it over to Shireen Hodge-Ryan, who is our Central Maryland Regional Quality Enhancement Director.
Good morning. Thank you, Caroline. Here's a full picture of the incident reporting process overall. First, an incident occurs, then the provider and/or CCS submits a full incident report into PCIS2. Calls are made to the needed people such as family, CCS, DDA regional office, at times APS, police, and possibly others, As we have discussed in today's webinar, depending on the type of incident that occurs, DDA reviews all incidents but investigates type 2 incidents. OHCQ investigates all type 1 incidents, so then an investigation is completed and a final decision or outcome is communicated. OHCQ issues Notice of Compliance, also known as NOC, or Standard of Deficiencies, which is known as an SOD to the agency. Overall, with any incident, the internal team should take a greater look and see if there needs to be any PCP updates/changes or any additional support services needed for the person. Then, if an SOD was issued, the agency should take the time to look and see if any changes that need to occur within the entire agency. Are there trainings that need to occur for all staff, possibly? At times, we will find staff need additional behavior support plan training, nursing care plan training, and possibly others. Then lastly, statewide, the DDA looks at all incidents, reviews, analyzes, possibly begins new items that are found or needed statewide, whether it's training, a new guidance is issued, changes made in PCIS, etc. Next slide, please. I'm sure many are wondering, what does an investigation consist of? Or what does it look like? Unfortunately, since each incident is different and the severity is different, the DDA will provide a small overview of what an investigation looks like. Investigations usually consist of a site visit to a day program, administrative site, i.e. the main office, or where the person lives. Usually, a full site inspection begins with surveyors from OHCQ or DDA Regional Office Quality Enhancement Team. They are making sure that the agency is following COMAR regulations and looks for items that are needed to change to make things better and to see if items are not following standards. During a site visit, at times, a file review is conducted, looking at the person's PCP, making sure services are being provided, adequate staffing is in place, medications are being given per the Maryland Board of Nursing standards, and making sure staff training is completed. Interviews also occur during an investigation. Communication with the person or persons occurs, interviews with staff involved, staff that were witnesses, and administrative staff, nursing supervisor, for example, all happens if needed. At times, the nursing staff from OHCQ and/or DDA are involved, looking at the full medical picture, asking for medical documentation from the provider, from the hospital, to make sure they are able to make a professional, educated decision on the results of the investigation. And then, depending on the incident, Adult Protective Services, Child Protective Services, law enforcement could also be investigating. At this time, the DDA does not interfere with their investigation, but will conduct our own at the same time. Many times, APS and/or CPS may not give OHCQ or the DDA a final decision of their results of their investigation. At the conclusion of an investigation, OHCQ issues either a notice of compliance documenting that the provider is in compliance with all COMAR regulations and that there was nothing found to show that the allegation to be true. Or a standard of deficiencies is issued documenting that the provider is not following the COMAR regulations standards and the incident was found to be accurate. The provider needs to solve the issues noted and send their plan of corrections on what they will do to fix things within 10 business days. If you or your family member, legal guardian, would like to know the final outcome of the investigation, DDA would encourage you to keep in contact with your CCS and/or provider. Next slide, please. Monitoring and implementation. Once the final outcome is determined and issued, the process does not stop there. The DDA regional office will complete a site visit after the letter of determination is issued to follow up to make sure the provider has begun to follow their plan of corrections. With each incident, the DDA regional office tracks all of them and does a review of all of the data at least quarterly, if not more often. The DDA statewide Director of Quality Enhancement reviews data and determines if there is a statewide trend in any particular area. This information is shared with the DDA leadership and shared with the DDA Quality Advisory Council. Any suggestions on how DDA can improve in any identified areas of concern is discussed, and a plan is developed to make any needed changes. For example, if there was an increase in choking, then a choking refresher training statewide would be made available. We have included a small visual of the fatal 5 that was reviewed before to show a small sample of what we do. This graph shows by region, by identified colors, how many people have been diagnosed with any of the fatal 5 diagnoses. The fatal 5 include bowel obstruction, choking, seizures, sepsis, and GERD. Next slide, please. Oops, I'm sorry, I skipped. Now we will review this scenario. On October 20th, 2021, Jane Doe reported to her morning staff, Clara, that her overnight staff was screaming at her and grabbed her arm to take a shower last night. There was a visible bruise on Jane's left arm. Clara reported the incident to her supervisor immediately. So what happens next? Clara's supervisor immediately reports to APS or CPS of the statement. The provider will also reach out to the person's family, CCS, and the DDA regional office. An incident report will be filled out in PCIS2 within 24 hours. When an incident report is done and sent, an automatic alert is sent to the following persons: CCS, the DDA regional office, OHCQ, and the state Medicaid office. Since this will be known as an abuse incident, OHCQ automatically ranks the incident and began an investigation in which they would start within 2 business days. Refer back to our OHCQ prioritization slide. OHCQ will complete a full investigation and issue an NOC or SOD to the provider. Within their investigation, they will complete the investigation steps we discussed, such as speaking to the person, any witnesses, site visits, or even a file review. A full investigation is needed to be completed within 45 days from when it started. At times, if CPS, APS, law enforcement is involved, it could take longer depending on how long it takes for them to complete their investigation. OHCQ will conduct their investigation at the same time, but they will wait to send out the NOC or SOD until other parties like APS have ended their investigation and provided documentation on their outcome. If an SOD is issued, then the provider has 10 business days to send a plan of correction back to OHCQ stating how they will fix things and follow the COMAR regulations. They follow the COMAR regulations they were in violation of. Once the POC is approved by OHCQ, the DDA regional office will follow up with the provider within 3 to 6 months at times to make sure they are following through with their POC and there are no further violations. As we discussed previously, the DDA looks at all incidents regionally and statewide and does any tracking and trending. This provides a small summary of how an incident is reviewed, what an investigation process looks like, and then the post-investigation summary. I hope this gives everyone a better understanding of the whole incident reporting process and why it's important for all to report. Next slide, please. Now that we have reviewed the policy about reportable incidents, gave an overview of the process of investigations, it is important for everyone to know how to report an incident. As we always say, if you see something, say something. Here, we have included the DDA website, and if you click on that, it will take you to the website directly. From there, you will scroll down on this main page to the icon for Report Abuse or Concern. This page gives you a quick glimpse of what to do. If you scroll towards the bottom, it provides you multiple steps. In step 3, it states to, if no action is taken by a supervisor, contact OHCQ. There it will provide you a link to OHCQ's landing page. This landing page is what is here on this slide. You can see the red arrow is pointing towards file a complaint. That is where you would need to go to make an electronic submission of an incident to OHCQ. Or on the next slide, we have provided the regional office contact information. Next slide, please. Here, we have included all the designated emails for each of the regional office triage emails along with OHCQ email to report incidents. These mailboxes are reviewed Monday through Friday, except for state holidays. Next slide, please. Please make sure you take note of this page as it has all of the statewide regional contact information. Please utilize the regional office if you have any questions or concerns. We have also listed the after-hours number for your reference. If there were any emergencies to report, please use the listed numbers on this slide. Also, note you can reference the DDA website for DDA's headquarters contact information if you need additional assistance. Next slide, please. Now I will turn it over to Nicole Kropfelder, our statewide quality enhancement director.
Thank you, Shireen. At this time, if anyone has any last-minute questions, please take the opportunity to please put them in the chat box. Again, we want to say thank you for attending today, and we hope that you find this information useful. Please keep a lookout in your email of our follow-up with the questions and answers in about 2 weeks from today. They will be posted on our website, and this webinar will also be posted on our YouTube page. Again, thanks for joining us today, and have a great day.